Assalamu alaikum. Good morning to one and all. Today in this video, I will be discussing about peptic ulcer disease, or we can say peptic and duodenal ulcer. Okay. So before I start this video, I have a small request. Please watch this video till the end so that you can get all the points clearly understood. Okay. So without wasting much time, let's move directly towards the topic. Okay. So as today we are going to discuss about peptic and duodenal ulcer. First and foremost, let me tell you how this ulcer is formed. Okay, see, let's take a simple example. Okay, so if a person is suffering from chronic gastritis, that is inflammation of the gastric mucosa, understanding a digestive tract. So what happens mainly when there is a chronic inflammation? Chronic inflammation will be followed by the ulcer. I will tell you how. See, when the stomach acid keeps on releasing because palatal cells which are present inside the stomach, understanding, they are responsible for the synthesis and production of the HCl and pepsin. So when they keep on secreting the HCl, what happens? As a result, it will be trying to damage the gastric mucosa, or we can say mucous membrane, or we can say lining of the stomach. So as a result, there will be the breakage in the gastrointestinal lining, or we can say gastric stomach lining or duodenal lining. So as a result, what happens? There is a development of the open sores, or there is a breakage, or there is the formation of lesions, understanding, on the surface of stomach. Okay, so that is only known as ulcer. Okay, so now let me talk about what is peptic and what is duodenal ulcer. Okay, so peptic ulcer disease, it can be defined as, understanding, disorder of the gastrointestinal system which is characterized by a lesion, breakage, or we can say open sore which is formed in the lining or mucosa of the digestive tract. Typically it will be produced or formed on the stomach, or we can say any part of the stomach, or we can say on the duodenum, because as I have already told you, peptic and duodenal ulcer. So peptic means that is related to the stomach, and duodenal means related to the duodenum, understanding. And how this occurs? As a result of this one, digestive action, understanding, digestive actions of HCl and pepsin. HCl and pepsin are the stomach acids which are helping in the breakdown of the food, understanding. So now what could be the causes? The most prominent or abundant cause of this one is chronic gastritis. So here you can see this one is stomach, understanding. So this one is the stomach, right? You can see this one is the fundus, this one is the body, and this one is the pylorus or pyloric antrum, understanding. So and it will be also depending whether the sore is formed, ulcer is formed in which part of the stomach, whether it is the fundus or it is in the formed in the on the surface of the body of the stomach, or we can say pylorus or pyloric antrum, understanding. So that's why I have already told you we can differentiate the two types of ulcer, that is peptic ulcer and duodenal ulcer. Duodenal ulcer is this one, understanding, on the mucous membrane lining of the duodenum, and on the lining of the stomach, that is stomach, we can say peptic ulcer. Okay, so the most abundant cause of this stomachal ulcer is chronic gastritis. And that chronic gastritis, how that is caused? Because of the presence of H. pylori, that is Helicobacter pylori infection. We can say that here, you can say that H. pylori infection, understanding, 90% of people who are suffering from peptic and duodenal ulcer, they are the cause would be Helicobacter pylori infection only, understanding. And chronic gastritis जो होता है ना, उसका भी cause Helicobacter pylori हो सकता है, ठीक है, understanding. And next one will be like smoking, we can say alcohol consuming, understanding. We can also say when there is the drug overdose. We can say when you are keeping on taking the NSAIDs, that is non-steroid anti-inflammatory drugs, understanding, for the prolonged period of time, बहुत सालों तक ले रहे हो कोई पेशेंट, तो जिसकी वजह से उसका जो गैस्ट्रिक म्यूकोसा है वो डिस्ट्रॉय होता है या डैमेज होता है, ठीक है, या स्ट्रेस की वजह से भी हो सकता है. अगर कोई स्ट्रेस लेता है, if anybody is taking stress, understand, that will be suppressing, understand, the immune system. So as a result, immune system is unable to tackle with the pylori infection, we can say Helicobacter pylori. So as a result, there is a formation of open sores, or we can say mucous membrane is being broken down, understanding, because of the much more secretion of the HCl, understanding. And we can also say beverages like tea, coffee, या we can say hot or spicy foods. अगर कोई hot or spicy foods लेता है, या we can say junk foods, understanding. So we can say also those people who are taking the foods which are lacking in the जिसमें nutrients कम होता है, या जो low fiber diets होता है, ठीक है ना, तो उसकी वजह से भी हो सकता है। या वी कैन से आल्सो मैलिग्नेंसीज, अगर कोई ट्यूमर फॉर्मेशन है, ठीक है ना, स्टमक के अंदर या कहीं और, स्टमक के अंदर मींस के गैस्ट्रोइंटेस्टाइनल ट्रैक्ट के अंदर, ठीक है ना, वो स्प्रेड हो सकता है ब्लड स्ट्रीम के थ्रू, अंडरस्टैंडिंग वहां पे, सो वो भी कॉज कर सकता है अल्सर फॉर्मेशन। ओके, सो एजिंग भी हो सकता है। एजिंग मतलब एजिंग प्रोसेस, जो एजिंग प्रोसेस है, एजिंग थ्योरीज में ये भी मतलब लिखा होता है कि वहां पे ये भी दिया होता है कि जितना भी एक पर्सन, ठीक है ना, 50 इयर्स के बाद, क्योंकि 50 इयर्स के बाद जो पीपल होता है ना, ओल्ड एज जो होता है ना, उनमें भी बहुत ज्यादा चांस होता है 50 एज के बाद, यानी 50 ईयर के बाद उनमें ये पेप्टिक अल्सर डिजीज पाया जाता है या डेवलप हो सकता है। ठीक है, सो दीज आर सम कॉजेज एंड रिस्क फैक्टर्स, या वी कैन आल्सो से जेनेटिक, जेनेटिक भी हो सकता है, सॉरी टू से, जेनेटिक भी हो सकता है, यानी फैमिली हिस्ट्री, अगर घर में किसी को है, या फादर को है, या ग्रैंडफादर ग्रैंडमदर को है, तो उनका जो ऑफस्प्रिंग है, उनका जो चाइल्ड है, उनमें भी जीन्स के थ्रू ट्रांसफर हो सकता है। ठीक है, सो दीज आर ऑल द कॉजेज एंड रिस्क फैक्टर्स व्हिच आर रिलेटेड टू द पेप्टिक एंड ड्यूडेनल ulcer. Okay, so now we will discuss about the pathophysiology of the peptic ulcer disease, or we can say peptic and duodenal ulcer. So we will take any cause, understand, we will take any cause, whether it is the smoking, whether it is the non-steroid anti-inflammatory drugs, prolonged period of time when we are using, understanding, when there is an aging factor, when there is a smoking, so whatever the causes there. Okay, so we can see that how that causes has played role in developing the ulcer, in developing the formation of sores, understanding. So here we can say that due to etiology, any type of cause like NSAIDs, alcohol, smoking, what happens mainly, that will make the stomach to secrete the more HCl, that is the excessive secretion of the stomach acids, that is followed by the pepsin and hydrochloric acid. Okay, so what happens, as there is the production of more HCl, the mucus secretion gets decreased, understanding, stomach is unable to secrete the cells, the goblet cells which are present in the stomach lining. Okay, they are unable to produce the this one mucus secretion, they are unable to secrete the mucus, understanding, yeah, glands. Okay, so they will be, so because this HCl and pepsin, it will be suppressing these goblet cells not to produce the mucus. Okay, so as a result, what happens, there is a decrease in the mucus secretion that can cause acute gastritis, that is inflammation of the gastric mucosa, and when that acute inflammation remains intact, what happens, there is the mucosal breakdown, understanding. So when this acute gastritis, understanding, it becomes the chronic gastritis, understanding, when there is the chronic inflammation of the gastric mucosa, it will be causing in breaking down the gastric mucosa. Why? Because there is the more exposure of the HCl, and what happens, this HCl and pepsin, it will be entering to the gastric mucosa, and it may also go to the deep, that is mucosal lining, or we can say then muscular, we can say mucosa propria membrane, yeah, we can say deep layer of the mucous membrane, yeah, deep layer of the stomach membrane lining. Okay, so it may enter there and it may break. When it will be breakdown, so there is the formation of open sores, or there is a formation of open sores, that is called as ulcer formation, so we can say, and that is also followed by the bleeding, because as the inflammation grows, अंडरस्टैंडिंग, जितना इन्फ्लेमेशन ज्यादा हो जाएगा वहां पे ज्यादा WBCs जाएगा, so the WBCs will be margining there and inflammatory mediators will be coming and there it may cause more bleeding, understand, वहां पे ज्यादा bleeding होगा, तो जिसकी वजह से वहां पे हम बोल सकते हैं it will show the signs and symptoms. Okay, so this was all about the pathophysiology. Now next one is about the clinical features. Okay, so clinical features, but we will first differentiate clinical features because there is stomach ulcer and there is peptic ulcer. See, there will be epigastric pain, understand, there will be the epigastric pain because of the ulcer formation followed by the bleeding, followed by the excessive bleeding. Okay, so what happens mainly in the case of this one stomach ulcer, what happens when a patient or when a person is ingesting or he is taking the food, soon after the food taking of food, so he will be having the pain, उसको pain हो जाएगा food खाने के बाद या खाने के बाद pain हो जाएगा, बहुत ज़्यादा pain हो जाएगा, okay, and that pain is not relieved by the food, वो pain जो होती है ना वो खाने की वजह से, खाने के बाद अगर खाना खाएगा तो उससे वजह से या मेडिसिन इसकी वजह से relieve नहीं होगा. Okay, now next one is the duodenal ulcer. In the case of duodenal ulcer, when a patient is having the chronic pain, patient will be having the pain followed by the दिस वन फूड बट लेटर, मतलब बहुत टाइम के बाद, जब अभी खाना खाया, ठीक है, उसके बाद लेट में या लेट नाइट के दौरान या अंडरस्टैंडिंग, या उसने सुबह लंच में खाया तो लंच में खाने के बाद उसको नाइट में या इवनिंग में पेन स्टार्ट हो गया, ठीक है ना. सो इट मीन्स दैट इन duodenal ulcer the pain will be coming later, understanding. But what happens in the duodenal ulcer when a patient is taking the this one antioxidants, a patient is taking the food, the pain will be relieved, understanding. So that will be symptoms in the duodenal ulcer. The next thing is about, that is nausea, vomiting. Okay, nausea, vomiting is followed by the production of this one okay, there is a obstruction of the obstruction of the stomach. जब वहां पे gastrointestinal जो मेम्ब्रेन होता है ना, या वहां पे वो जो ल्यूमेन होता है, जब वहां पे obstruction होगा तो उसकी वजह से वोमिटिंग हो सकता है, ठीक है. नेक्स्ट वन हेमेटोमेसिस, दैट इज ब्लड इन वोमिटस, ठीक है ना. मैंने पहले ही बोला वहां पे ज्यादा ब्लीडिंग होगा तो वो जब पेशेंट वोमिट करेगा तो उसके साथ ब्लड भी आ जाएगा, अंडरस्टैंडिंग. एंड वी कैन आल्सो से esophageal irritation, we can say also this one heartburn सिम्टम. क्यों? क्योंकि जो ऐसे ज्यादा रिलीज हुआ है ना, तो वो एंटर हो सकता है किसमें, इसोफेगस के अंदर, और इसोफेगस के लाइनिंग को डिस्ट्रॉय करेगा या डैमेज करेगा, या इसोफेजाइटिस भी हो सकता है जिसकी वजह से आपको चेस्ट, ये सॉरी क्या बोलते हैं उसको, यानी हार्ट बर्न, या वी कैन से हार्ट सेंसेशन या बर्निंग सेंसेशन हो जाएगा, अंडरस्टैंड, या हार्ट बर्न हो जाएगा, ठीक है. नेक्स्ट वन वुड बी लाइक जे ब्लीडिंग, तो बोला है. देन ऑब्स्ट्रक्शन विल बी देयर फॉलोड बाय द क्रॉनिक इन्फ्लेमेशन, या क्रॉनिक इन्फ्लेमेशन, अंडरस्टैंडिंग. देन वी कैन से आल्सो लास्ट वन एपिसोड्स ऑफ रिमिशन एंड एक्सरसेबेशन. व्हाट डज इट मीन? इट मीन्स दैट व्हेन यू आर टेकिंग द ड्रग्स और व्हेन यू आर टेकिंग द फूड्स इन द duodenal ulcer, द पेन विल बी रिलीविंग, बट सून आफ्टर उसके बाद फिर से पेन हो जाएगा, ठीक है ना. जब फूड डाइजेस्ट हो जाएगा, डाइजेस्ट होने के बाद जब स्टमक खाली रहेगा, when the stomach is empty, that time again the pain will be arising, understanding. Or sometimes when you are having the food will be, pain will be there, but sometimes when the food is being digested from your stomach, from your intestines, from your stomach, and there is the reoccurrence, any pain will be again coming, that means the remission, any pain फिर से आ सकता है, ठीक है. Now next one is about the diagnostic evaluation. So in the diagnostic evaluation, as I already told you, that this may be caused due to the अंडरस्टैंडिंग ड्यू टू द जेनेटिक फैक्टर्स. अगर फैमिली के अंदर किसी के अंदर H. pylori इन्फेक्शन है या कोई और पेप्टिक अल्सर है, तो ऑफस्प्रिंग जो ऑफिस होगा, जो चाइल्ड होगा, उसको भी हो सकता है, ठीक है. तो इसलिए हम हिस्ट्री में देखते हैं, और हिस्ट्री कलेक्शन में हम ये भी देखते हैं NSAIDs तो नहीं लिया है, या पेशेंट जो है वो अल्कोहल स्मोकिंग तो नहीं करता है, क्योंकि वो फैक्टर बन सकता है, ठीक है. Those will be becoming the predisposing factors in developing the ulcer formation. Next one is the physical examination. Physical examination is followed by the 4 methods, that is inspection, palpation, percussion, and auscultation. Through these methods we can assess, we can palpate, and we can know the identification, we can know the location of the internal organs. We can also listen to the bowel sounds. We can also listen to the movements of the gastrointestinal organs, understanding. So in order to determine the abnormalities. Next one is about the radiological assessment, understanding. So radiological assessment is followed by the barium meal, a barium X-ray, understanding. A doctor, he is going to ingest the barium meal, understanding, to the patient's stomach, so that he can assess the abnormality, he can detect the abnormalities of the gastrointestinal tract. Okay. Then serological testing. Serological testing में हम mainly करेंगे एक लेबोरेटरी टेस्ट है, उसके अंदर हम करेंगे ELISA टेस्ट. सो ELISA टेस्ट में क्या करते हैं हम, ठीक है ना, उसमें हम when we are going to do culture and sensitivity of this bacteria, जब हम culture and sensitivity करेंगे, so soon after we can get from the culture that there is the development or growth of bacteria, that is H. pylori, understanding. Next one is the endoscopic procedures, ठीक है ना. So endoscope हम क्यों करते हैं, ताकि so that we can know the location, size, shape, growth, understanding depth of this ulcer formation. Yeah, we can say also area, understanding. And we can also say, we can also go for the CT MRI. CT MRI हम भी देख सकते हैं obstruction तो नहीं हुआ है, understanding, bleeding तो नहीं है, understanding, या depth of ulcer, कितना deep ulcer हुआ और कहाँ पे किस एरिया में हुआ है. And last one would be stool examination. Stool examination is followed by, so that we can detect the presence of the germ, presence of the germs, or presence of the H. pylori infection. Okay, so the next one is about the management of peptic ulcer disease. Okay, so what will be coming under the management? So understanding, so the main objectives of the management would be relieving the discomfort, protecting or preventing the patient from occurrence of the complications which are related to the disease, and if this disease left untreated for over the period of time, a patient may also die, okay, in case of this peptic ulcer disease. Okay, so what are the medical managements and what is the surgical managements that I am going to tell you. Okay, so first one is the medical management. In medical management, if in case the cause is Helicobacter pylori, then we can go for the antibiotic therapy, or we can go antibiotics. So in that we are going to give the amoxicillin, we are going to give the clarithromycin, and we are also going to give the metronidazole in order to inhibit or kill the H. pylori bacteria. And next one is antacids. Antacids, why we are going to give? In order to inhibit the secretion. We are going to inhibit the parietal cells to produce the HCl and pepsin, so that the gastric mucosa will be prevented for the further damage. Okay, so that may include magnesium hydroxide and ammonium hydroxide. Okay, aluminum hydroxide, sorry. And next one will be H2 receptor blockers, H2 receptor antagonists. Okay, so they will be also acting in order to decrease the secretion of HCl by giving the ranitidine and cimetidine. Okay, the next one we are going to give the proton pump inhibitors. Proton pump inhibitors may include omeprazole, pantoprazole. Understanding, they will be also acting on the parietal cells to decrease the amount of this one HCl and pepsin secretion. And mucosal protective agents, we are going to give some agents which will be protecting the lining of the stomach or duodenum, and in that we are going to give the sucralfate and bismuth. And then last one we are going to give the anticholinergic drugs, because these anticholinergic drugs, they will be inhibiting the release of, we can say, neurotransmitters, that is acetylcholine. Understanding, because when the acetylcholine is being released, there will be the excessive movements of the gastrointestinal mucosa, parietal cells. Because see, why we are giving the anticholinergic drugs? In order to reduce the movement actions of the parietal cells, so that they cannot produce much more acid, and in resulting in damage of the further damage of gastric mucosa. So we can give atropine and we can also give benzotropine. Okay, now next one is about the surgical management. First one is the gastrectomy, followed by the vagotomy, and also we can say enterectomy. Okay, so what is gastrectomy? Gastrectomy is the removal of portion of the segment of the stomach. Understanding, stomach, or we can say duodenum. Okay, so what we can do, first one is the subtotal gastrectomy. Subtotal gastrectomy means, for example, if there is the stomach is being affected, so one portion, one part of the stomach, or we can say duodenum, is affected, then we can remove that damaged part. Understanding, which is unable to recover, जो recover नहीं हो सकता. Then partial gastrectomy means a portion or segment, the area where this one small area will be removed, that is a resection. Understanding, gastrectomy means that is a resection. So we are going to remove the area, the portion which has been affected. Understanding. And then next one is the enterectomy. What is enterectomy? Antrum means last part of stomach, because see, antrum is only the part of stomach where the much more gastric juices are secreted, that is gastric acids are secreted, that is pepsin is secreted. So this area is more prone to get affected with the peptic ulcer disease. So that's what we are going to remove, the last part, the third part of the stomach, in order to prevent the further complications. Okay, the last one is about the vagotomy. Vagotomy means we are going to cut off, or we are going to block or the way of the vagus nerve, so that, because when the vagus nerve is there, so that vagus nerve will be stimulating the parietal cells to produce the HCl. So we are going to cut the vagus nerve only, block the vagus nerve only, so in further damage, this one secretion of the HCl. Okay, so in case we have removed the stomach, we have removed the portion of stomach, whether we have removed the fundus, whether we have removed the body, whether we have removed the segment, or whether we have removed the antrum, or we can say duodenum. So in case when it has been removed, now it has to be surgically connected. Okay, इसको हम surgically connect करना है ना, तो कैसे करेंगे? So it is done followed by two methods, that is gastroduodenostomy and gastrojejunostomy. Gastroduodenostomy को हम बिलरॉथ 1 भी बोलते हैं, और गैस्ट्रोजेजुनोस्टोमी को हम बिलरॉथ 2 भी बोलते हैं. देखो, गैस्ट्रोजेजुनोस्टोमी में हम क्या करते हैं? एनास्टोमोसिस ऑफ गैस्ट्रोड्यूडेनल बाय सीविंग, यानी गैस्ट्रोड्यूडेनल जंक्शन बाय सीविंग. यानी इसका मतलब होता है, इन केस हमने स्टमक का कोई पोर्शन रिमूव किया, फॉर एग्जांपल वी हैव रिमूव्ड द एंट्रम पार्ट, अब वी हैव रिमूव्ड द बॉडी, सो वहां पे जो फंडस है ना, फंडस को हम कनेक्ट करेंगे किसके साथ? ड्यूडेनम के साथ. अंडरस्टैंडिंग, ताकि हम गैस्ट्रोइंटेस्टाइनल मोटिलिटी को इंप्रूव कर सकते हैं. ठीक है ना, तो उसको हम बोलते हैं बिलरॉथ 1. नेक्स्ट वन इज बिलरॉथ 2, यानी एनास्टोमोसिस का मतलब क्या होता है? सीविंग. ठीक है ना, चाहे हम हाथ से, चाहे डॉक्टर जो है ना वो मैनुअल सीविंग करता है, या वी कैन से मैकेनिकल, दैट इज लेप्रोस्कोपिक सीविंग. ठीक है. नेक्स्ट इज गैस्ट्रोजेजुनल स्टोमा, इसका मतलब होता है ब्रदर ऑफ टू। इसका मतलब होता है कि इन केस ड्यूडेनम हैज बीन रिमूव्ड, अगर किसी भी कंडीशन में ड्यूडेनल अल्सर है और ड्यूडेनम को हमने रिमूव किया है, ड्यूडेनम को रिमूव किया है, तो वहां पे क्या करेंगे, जो स्टोमक का पार्ट होगा, फॉर एग्जांपल थर्ड पार्ट इज द एंट्रम, तो एंट्रम को हम डायरेक्टली किसके साथ कनेक्ट करेंगे, जेजुनम के साथ, ठीक है। सो इन ऑर्डर टू इंप्रूव द गैस्ट्रोइंटेस्टाइनल मोटिलिटी और गैस्ट्रोइंटेस्टाइनल फंक्शनिंग, सो बाय सिविंग द एरिया, बाय कनेक्ट सर्जिकली कनेक्टिंग यूजिंग द सिविंग, यूजिंग द हैंड, बाय डूइंग द हैंड और बाय डूइंग द लेप्रोस्कोप, लेप्रोस्कोपी की वजह से हम कर सकते हैं सर्जिकल कनेक्शन, दैट इज नोन एज एनास्टोमोसिस। ओके, नाउ लास्ट वन इज अबाउट द कॉम्प्लिकेशंस। अगर ये स्टोमक अल्सर या पेप्टिक अल्सर को ट्रीट नहीं किया गया ना, तो इसकी वजह से क्या हो सकता है, कैंसर भी हो सकता है, स्टोमक कैंसर भी बन सकता है और सीवियर गैस्ट्रोइंटेस्टाइनल ब्लीडिंग भी हो सकता है। एंड इन केस अंडरस्टैंडिंग इन द सीवियर केसेस पेशेंट में आल्सो डाई, पेशेंट मर भी सकता है। ओके, सो दीज आर द कॉम्प्लिकेशंस व्हिच आर रिलेटेड टू द पेप्टिक अल्सर डिजीज। Okay, so now last one is about the prevention and control of peptic ulcer disease. Okay, so as the patient has been diagnosed with the peptic ulcer disease, understanding now the doctor has given him the treatment, whether it is the medical treatment or the surgical management. So as a nurse, it is your responsibility to understanding to prevent the patient from getting further infections. You have to prevent the patient from getting the complications which are related to the disease only. So you can provide health education to the patient by telling him that he should not consume the irritants like spicy foods, alcohol, smoking, understanding, and you have to also give him the nutritional management, that is dietary management, balanced diet, understanding if there is any nutritional deficiency, you have to assess as a nurse, and then you have to provide the nutritional support. You have to ask the patient to always remain hydrated, also take plenty of water, understanding, and also you have to take some strategies in order to prevent the complications of the disease. Okay, so I hope you have understood about this topic. Okay, so if you have any doubt, you can ask me in the comment section. I will try to clarify your doubt. Okay, so this was all about today's topic. Hope you have understood. Allah Hafiz. Asalaamu Alaikum.